Assalamu alaikum everyone. Today I'll be talking about how to prepare for the induction exam in KPK for postgraduate training, specifically in general medicine and medicine specialties. This exam is conducted after you clear your FCPS Part 1. Once you pass Part 1, you have to sit for the induction exam in KPK. It's a score-based exam consisting of around 100 MCQs. The duration is about 2 to 2.5 hours. Now let's talk about the preparation strategy. So when should you start? Well, the preparation should begin immediately after you clear your FCPS Part 1 because the induction exam is tougher than Part 1. What books and resources you need? Well, you'll need to use multiple resources. MTB, Master the Boards, Step 2 CK, guidelines-based. Then you need MRCP books, past medicine, MCQ-based with explanations. There are also past medicine notes available, no MCQs but concept-based and guidelines-oriented. You can also use Irfan Masood for medicine, a reliable middle ground between US and UK guidelines and very relevant for Pakistan. Next is Pgmi book, includes communication skills, English, biostatistics, ethics and MCQs from medicine, surgery and dentistry. You also need to have ETEA notes specifically useful for English MCQs. They are available in Pgmi preparation groups. You can easily find them there. Okay, how to use these resources? Well, you should start with MTB, that's your main book to all the systemic chapters, plus oncology, preventive medicine, emergency medicine, some topics from surgery, psychiatry, obs, gynae like breast cancer, etc. You have to study guidelines-based first from MTB, then MRCP, past medicine notes, just important topics repeated in previous MCQs. You have to go through the MTB thoroughly, but from MRCP past medicine notes, you just have to do the important topics. Follow Irfan Masood wherever there's confusion between MTB and MRCP guidelines. Some people also do Irfan Masood instead of MTB and MRCP both, but I wouldn't recommend only doing it if your concepts are weak and MTB is good for retention. So, practice past MCQs in Pgmi book to identify repeated questions and patterns of MCQs what is being asked. Also use the Pgmi book for non-clinical portions like English, biostatistics, ethics and communication. You also need to revise basics that you did in FCPS Part 1 because the exam, about 10% is from basics, which you can do from Refuella or from first aid, especially immunology, genetics, biochemistry, and sub-introductory chapters. Okay, let's talk about the exam breakdown. So the exam consists of 50 to 60% clinical, diagnosis, investigations, treatments, stepwise management, and the 10% of exam consists of basics from first aid and Refuella book. The rest, there is English, communication, ethics, and biostatistics. Okay, what should be your scoring strategy? Your target should always be 70 plus correct answers. Never aim below 65. Out of 100 MCQs, you should be 100% sure about at least 65 MCQs. Spend more time on confusing MCQs, think logically, and don't let tricky wording mislead you. The timeline that you need to prepare for the exam is almost 2 to 3 months. If you have less time, you should do a focus study. But ideally, if you have enough time, then give yourself at least 4 to 5 months for a solid preparation. Okay, so my final tip for the exam is that it requires hard work plus smart work. Unlike FCPS Part 1, you cannot rely only on MCQs. You must go through the theory books thoroughly. Revise MTB and Pgmi books properly at the end. Go through past MCQs in Pgmi book carefully. Note down any controversial guidelines you are confused about and clarify them before the exam. Best of luck for your exam. If you found this video helpful, please like, subscribe, share it with your friends and stay tuned for more informative knowledge. Thank you.